A woman in Quebec whose age has not been released experienced a rare blood clot with low platelets, which are tiny blood cells that help your body form clots to stop bleeding. It happened after getting the Covishield version of AstraZeneca. She's said to be recovering at home.
Now we know this event could happen. It's rare, but it's serious. But now that we can recognize it, diagnose it, we can quickly treat it. And once we get it treated, the patient can be quickly on their way to recovery.
Dr. Isaac Nazi was one of the scientists at McMaster University who confirmed the blood clot case. In total, they had tested 10 blood samples from across Canada suspected to be blood clotting issues from the AstraZeneca vaccine.
Immediately resolved 9 of them because they did not have any antibodies, and we reported back within a few hours to 1 day.
Health Canada tweeting, "These reports are very rare, and it shows that Canada's vaccine safety monitoring system works."
The chances of getting COVID and developing clots and dying from the clots is much higher than getting it from the vaccine.
While studies continue, there has already been a pause in using AstraZeneca in those 55 and younger across the country. Ontario just received another shipment of the vaccine.
We're still waiting to find out the delivery schedule for future deliveries of AstraZeneca, but we also have the opportunity, if we don't receive it in the near future, we have Moderna.
Meanwhile, out of an abundance of caution in the United States, the FDA and CDC have suspended the use of the Johnson & Johnson vaccine due to blood clots.
This is a really rare event. If you look at what we know so far, there have been 6 out of the 6.85 million doses, which is less than 1 in a million.
Health Canada has launched an investigation of its own.
Assure everyone that Health Canada will, every step of the way, put the health of Canadians first and foremost in any decisions we make around distributing vaccines.
The J&J single shot is approved for use here in Canada, but manufacturing issues delayed the first shipment, which is still expected to arrive at the end of the month.
I'm concerned when I hear that coming down from the U.S.
Before any J&J is put into anyone's arms in Ontario, we need to know that it's going to be effective, but more importantly, that it's going to be safe.
All 6 cases in the U.S. involve women between the ages of 18 and 48, and the symptoms occurred 6 to 13 days after vaccination. There's been no decision made at this time from Canada's National Advisory Committee on Immunizations. The lab here at McMaster University is the only one in Canada that has been approved to receive samples and then check for these rare types of blood clots. It's actually one of only 3 or 4 labs in the world with this type of technology, and they're already using the data to try and determine who exactly is most at risk.